glomerulonephritis covers a wide variety of diseases, but what it means is it's inflammation in the part of the kidney involving the glomeruli, which are the filters of the kidney. So that's why it's called glomerulonephritis, and that's opposed to inflammation of the blood vessels or inflammation of the tubules of the kidney. So it's inflammation of the filters, the glomeruli in the kidney. It's quite complicated because there are many causes, but it's best to divide it up into diseases that purely affect the kidneys. So we call those primary glomerular diseases. And there are a number of different types, which are classified according to what the biopsy appearances are when you do a kidney biopsy. And your listeners may have read about these. They're called minimal change disease, membranous nephropathy, focal segmental sclerosis, IgA nephropathy. Those are the commonest types of primary glomerular diseases, and they vary. Those are very different diseases, and they vary very much in terms of outcomes. The other type of kidney diseases that affect the kidneys are, well, it's part of a multi-system disease. So there are certain diseases such as vasculitis or lupus or myeloma, which are part of a wider disease, and they affect the glomeruli in the kidneys. And again, the only way to make a diagnosis here is to do a biopsy, because it's very difficult to make a diagnosis without a biopsy. Sometimes for these systemic diseases, you can get a very good clues with the blood test, but generally we need to do a kidney biopsy. Again, this is very variable. Some people may have no symptoms at all and just have abnormalities on the urine tests, so blood in the urine, protein in the urine, or an abnormality of the kidney function. And a lot of patients come and see me and they're asymptomatic, but they have these abnormalities on their investigations that they have, often at a medical. Now, patients with more advanced or glomerulonephritis conditions may present with swelling, usually swelling of the ankles and the feet, legs, most noticeable late in the day, or with swelling of the eyelids, which is most noticeable at the start of the day. And finally, some patients can present really with advanced kidney disease and symptoms of kidney failure. So those are the general ways that patients can present. This covers a wide variety of conditions. So at one end of the spectrum, you have patients who will have very minor abnormalities in the urine, but that persists for life and there are no problems at all. Then you may have patients and this is the commonest type of kidney diseases, progress over years and decades, so very slowly. So the commonest glomerular disease that we see, IgA nephropathy, typically presents over many, many years. Very occasionally, we see people with what we call a very rapidly progressive glomerulonephritis, and those patients need to be treated urgently to stop kidney damage occurring irreversibly, and that is a very urgent emergency. So there's generic advice that we give to most patients who have glomerulonephritis, and there are lifestyle issues. People need to lose weight, to control their blood pressure, to take exercise, and to stop smoking. And those measures are actually very important because if people take these lifestyle changes, that can slow down progression of kidney disease very dramatically. The key over the last 20 years to the management of people with protein in the urine due to glomerulonephritis has been using the type of blood pressure tablets called ACE inhibitors or angiotensin receptor blockers, which from the 1990s has been shown to slow down progression of kidney disease. Now in the 2020s, the SGLT2 inhibitors look like they're the next paradigm shift and are going to be widely used in glomerulonephritis to slow down progression of kidney disease. And they're just starting to be rolled out. And then for specific kidney diseases, you need specific treatments. So, for example, minimal change disease needs to be treated generally with steroids initially, although you can use some other drugs. Other diseases also respond to immunosuppression, and historically we've used steroids and drugs such as drugs that we use in transplant medicine a lot, like mycophenolate or tacrolimus. Increasingly, we're using monoclonal antibody therapy, such as rituximab, and there are also some new and exciting treatments coming along. So it's actually an exciting time, and we've got lots of new treatments to improve the prognosis of patients with these types of kidney disease.